Hi, I'm Juliana. I'm a freelance care companion as well as a medical escort. Yeah, so basically I enjoy keeping people company. I was actually looking for a caregiver at that time. I actually went and actually searched, and that's how I came across Caregiver Asia, the website. And so after that, when I became a care seeker, that's how also I got to know about the online platform as well. Basically, it's the convenience because it's online. Anytime you just need to update as and when, it's just at your fingertips. It's very easy, and as well as you can do a very fast booking. You're not going through a middle person or third party, so you can do it at any time, 24/7. So basically, a care seeker can actually go online, take a look at the kind of services that they need, and from there they can browse the profile of the caregivers that may be shortlisted. And from there, they can actually either book directly, or they may drop me an email actually through the online platform. And from there, maybe if liaise it is fine and so forth, and then you can do a booking. Because most of the time, I realize some of these cases are like quite instant. They might need it urgently. Basically, what we have is actually our profile that is listed online. We actually list our experiences, some of the background that we can actually state as well. So probably maybe it's my very personal, and yeah, maybe attracted them besides the experience. As mentioned, it actually allows the care seekers to go through the availability of the caregivers that are interested in. Yeah, it was very simple because basically there's a step-by-step guide. So actually I referred to that in a way on how to set up both the profile as well as the subsequent listing for the services. Besides the online step-by-step guide, I also there's a chatbot inside your online platform. So probably they can actually use that to talk to someone to actually help them if they still have further issues. Yeah.
Hello, good afternoon. Okay, selamat petang tuan-tuan dan puan-puan sekalian. Selamat datang ke webinar hari ini yang bertajuk How to Build a Strong Diamond Mind Against Post-COVID-19 Challenges. Now, webinar ini organized by Caregiver Asia. As you can see, they were playing just now, okay, in collaboration with Braun. And this is for your information, this webinar will be recorded. Okay, now why we choose this topic? Because we know masalah gangguan emosi menjadi lebih ketara pada masa sekarang disebabkan oleh jangkitan COVID-19. COVID-19 ini menukar cara hidup dan kesihatan kita. Nah, mengikut data KKM, sejumlah 465 kes cubaan bunuh diri dilakukan sepanjang Januari sampai Jun 2020. Nah, ini adalah satu angka yang membimbangkan. Oleh itu, sebagai caregiver dan juga keluarga, memainkan peranan yang penting dalam mengenal pasti tanda-tanda, memberi motivasi dan membina satu positive mindset. Webinar ini bertujuan untuk memberi kesedaran dan untuk juga mengenali gangguan emosi ataupun depression, cara-cara membantu SCI mengatasinya mengatasi masalah ini. Ya, dengan itu saya ingin memperkenalkan speaker yang pertama iaitu Cik Umi Noliana. Tajuknya ialah Self-Care is How You Take Your Power Back. Now, beliau ialah seorang clinical psychologist di Ceras Rehab, Hospital Rehabilitasi Ceras. Ya, beliau graduate daripada IMU, Bachelor of Science dalam Psikologi, year 2016. Lepas Bachelor Science of Psychology, beliau continue to study Master of Psychology in Clinical. That is year 2018 until year 2000. Okay, so with an extensive experience working as a private tutor, trained with cognitive behavior therapy and also solution-focused brief therapy. Currently, beliau bertugas sebagai clinical psychologist di Hospital Rehabilitasi Ceras, and beliau is also a associate clinical psychologist with We Care Alliance Health Center in TDDI. Okay, right. So dengan itu saya akan mempersilakan Cik Umi buat presentation dia yang pertama. Now, sekiranya anda ingin tanya soalan, sila type dalam chat box dekat bawah on your screen. You boleh nampak ada satu chat. Okay, dalam chat box tu anda boleh type soalan. Kerana audio kamu telah pun di-mute-kan. Ya, okay. And speaker akan jawab soalan-soalan semua pada masa Q&A. Okay, dengan itu saya I pass over to you, Puan Umi.
All right. Okay. Thank you, sister. Assalamualaikum and a very good afternoon. My name is Umi Noliana and I am a clinical psychologist at Hospital Rehabilitasi Ceras. Before I begin my sharing, I would like to thank the organizers for inviting me and also for the participants for spending their time to join us this webinar this afternoon. All right, so my topic for today is called Self-Care is How You Take Your Power Back. In this sharing, I will start with simple statistics of SCI cases in Malaysia. Next would be type of adjustment and followed by strategies to cope with the challenges. All right. So in Malaysia, most of the patients, they are males who are younger than 40 years old and had paraplegia. Paraplegia is referring to impairment in motor or sensory function of the lower extremities from trunk below. Injury can be complete or incomplete. With complete injury means complete loss of sensory and motor function below the injury level. Whereas for incomplete, it means there is a partial or random preservation of sensory and motor function below the injury level. For the age group, there are two main age range, which are 25 to 34 years old and 55 to 64 years old. Three main causes of SCI in Malaysia are identified to be motor vehicle accident, fall from heights, and tumor related, which is known as a non-traumatic injury. Right, so spinal cord injury is known to have to cause a significant impact in many domains of a person's life. It hampers with patient's career, family relationships, and also their future. All right, so in general, there are three main aspects that are called for adjustment after the injury, which are physical, social, and emotional. In terms of physical, patients will have limitations of activities of daily living. This includes activities such as walking around, toileting, eating, and grooming. The most distressing situation for spinal cord injury patient is known to be the loss of independency in ambulation. So this is the most distressful distress situation for the SCI patients. All right, so next is social. Since most of the patients are men, many of them are known to be the breadwinner of the family. So once they get the spinal cord injury, they may lose their ability to provide for the family, lose the ability to earn an income, and also it may cause fragmentation of the family ties as well. All right, so spinal cord injury will also cause inability to fulfill social roles, such as being a teacher, being a soldier, or if you are part of the community member, being a spinal cord injury patient, it may hamper with your involvement in the community projects or activities. Right? For younger patients, younger men patients, they may also face difficulty to interact with people from the opposite gender due to insecurity and low self-esteem. So many of the patients actually, they share with me that they feel insecure to find a loved one to get married because of their disability. All right, so the third aspect would be emotional aspect, which is a which common emotional reaction showed by spinal cord injury patients are grieving over the loss and anxiety thinking about the future. Many of them are also afraid of burdening family members and feeling of hopelessness due to drastic changes in their lifestyle. Some of them may later develop more severe mental health issues such as depression, anxiety, and post-traumatic stress disorder. There is individual differences in the adjustment process. However, in general, individuals who sustain SCI must adjust immediately to a new way of life. This is because within a short period of time, these responses can become overwhelming and a more serious mental health issues, mental or physical health issues may arise, right? So they must adjust quickly to their new condition. Ultimately, however, most people do cope and manage the injury quite well, right? So to add on that, so currently the enforcement of movement control order due to pandemic outbreak has made the condition worsen for spinal cord injury patients. Like sister has mentioned earlier, all right, the statistic has arisen. Okay, the number of those who are attempting suicide has increased in Malaysia. So for spinal cord injury patients, they now have limited access to physical therapy and community fitness center. Besides that, there is reduced social interaction with people and no recreational activities with peers. And not to forget, many of them also lose their jobs and running out of savings to survive the tough times. All right, so in America, there is a study conducted among spinal cord injury patients, and the study revealed that there is an increased reports of depression symptoms, increased reports of anxiety symptoms, there is reduced quality of life and reduced emotional well-being, as well as decline in physical health. All right, so for spinal cord injury patients, they normally will have a set of exercise that they will need to do at home to strengthen their muscle, and, to keep their limbs mobility. All right. So according to this study, they found out that many of them also reported decreased range of motion despite trying to remain active at home. They tried to remain active, they tried to do the routine. However, there's still a decrease in range of motion because of the restriction. The findings call for strategies that should be implemented to reduce the adverse impact of COVID-19 among spinal cord injury patients. All right, so now we will discuss about the strategies to overcome the challenges. These strategies are doable and applicable for family members as well as the healthcare providers. First, it is very crucial to understand and also to let the patient and family members to understand the nature of injury. This is because the manifestation of the injury are distinctive for every patient. So it depends on level of injury, it depends on type of injury as well. So it is recommended to explain to patient and family member about level of severity based on the RCR scale and whether the injury is complete or incomplete, so that they have insight about the condition, and this will help them to have an idea on what are the things that they can do and cannot do, especially regarding activities of daily living, like I mentioned earlier, dressing, transferring, toileting and stuff. So it will be very helpful as the first step is to brief patient as well as the family members about their condition in detail. Get them to understand the condition and explain to them what are the general effects of the condition. All right, so based on research finding, so why is it very important, to explain to the patient as well as the family members about this? Because research finding has showed that neurological recovery was significantly different between all grades of SCI severity in the following order. Like for those who has RCR scale at C, they have better recovery than B, and B has better recovery than D, and D has better recovery than A. So what does it mean by A, B, C, D. So A means complete motor and sensory injury. So there's no motor movement, there's no sensory at the area below the injury. For B, it's sensory incomplete. They may feel, they may not feel, and then a complete motor impairment at that area. So C and D, they're motor incomplete, but the number of area that is affected is different. All right. So for E is normal neurological function. So for those who are at C, they have better recovery than they have the best recovery rate comparing to others. All right. So besides the ASIA level that will determine the recovery rate, the level of injury is also a significant predictor of recovery rate. All right. So those who had their injury at the lumbar, they have better recovery rate compared to those at the cervical, and then those at lumbar have lumbar injury also better than those who had injury at the thoracic level. All right. So all these are very important to explain to patients so that they understand and they have a clear picture on what to expect in the future. All right, so it actually will help them to prepare for the future as well, because one of the common emotional response is actually anxiety towards future. What are they going to do? What they can do? What they cannot do? So all this will help them to understand and also to prepare them. All right. So that was about the physical part. All right. So moving on to the emotion. For the emotion, it is very crucial for patients and family members to process their emotions and receive guidance in emotional adjustment. All right. So processing emotion means to validate and normalize their feelings. Patient may show range of emotional response such as anger, denial, sadness, and even bargaining about the condition. Sometimes patient will just share with us, what if I didn't ride the bike, I take the bus instead, and let's not get into this accident, my condition will be different, I still can walk today, but because of the bike I cannot walk today. So these are among the common emotional response showed by the SCI patients after the accident. All right, so what does it mean by validation? Validation means we validate their emotions. It means that to recognize and accept their thoughts, feelings, and behaviors as understandable. So for every person, there are various factors that shape a person's emotional response. Therefore, it is important for family members and healthcare providers to understand this, all right, so that we can accept their response as it is, and then for them to feel accepted. So because many of them actually they will say that no one understands me, no one will ever understand how I feel, so actually validating is to get the understanding on why they feel this way, why you feel so guilty towards your mom. So when you understand that from their perspective, that will give you clear understanding about their emotional response. All right, so self-validation also can be done by the patient itself, all right, by accepting their own thoughts, emotions, and behaviors. Right, so after all the emotions have been processed and understood, next it will be emotional adjustment. This step is when we'll do a discussion about adjustment to disability and stressful situation. So some may have extreme emotional and behavior response that may be unhealthy, and this will be discussed so that a healthy coping strategy can be adapted. So it is acceptable that they feel angry. However, how they manifest their anger, that is the thing that we will discuss during emotional adjustment. In order to do this, it requires modification of attitude and learning about appropriate expression of emotions. So these two steps are actually very crucial as it helps with personal acceptance and adaptations to one's condition. All right, so here is one of the common conflict patients will have. All right, so it is called independence-dependence conflicts. So this is one of the models that I commonly use to help my patients who have this conflict. So because for us, being independent in decision making and taking care of ourselves is a very precious freedom, because we actually progress. When we were born, we were dependent to others, and until a certain age, we started to become independent. And therefore, to become dependent again on others due to the injury is like a regression, you know, so you're going down the step. So it may be hard for them to accept that now they need to be dependent on others. All right. So to explain this to my patient, I'll normally use this model saying that human beings, we are actually interdependent with each other. So there's no only dependent person, there's no like independence, but actually we are interdependent. Even for normal people like us, we are interdependent. There are certain things that we can do it independently, but there are things that we need others to help us with that. All right. So after they have understood this, all right. So what we'll do during the session is we will do a list of things that patient can do independently and a list of things that they will need assistance from others. All right. So there are two lists lah in my session normally. So we will start to discuss for this independent list, right? What can you do to strengthen your skill, and also maybe to what can you train yourself in order for you to do this independent task, and what are the dependent tasks that you will need others to help you with. Right. So after we have these two sets of lists, I can see that they have better acceptance with their condition, and they will start to focus on the things that they can do independently. Because for some patients, after the injury, they will normally focus on the things that they cannot do instead of the things that they can do. So if they focus on things that they cannot do, they start to have the emotions such as feeling of hopelessness, feeling of worthlessness, self-blame. So all this will start to emerge lah if they focus on the things that they cannot do. So when we shift the focus to things that they can do, it actually help them. It actually help to boost out their motivation, and also change their perspective about the injury itself. All right. So besides emotional coping strategies, physical and coping strategies, there are also other coping strategies. All right. So positive reframing, like the first one, positive reframing means trying to reconsider things in a positive light, and it is a very powerful way to transform our thinking. It will reduce the damage, and it will put things into healthier perspective. So over the time, right, when they have learned the way to reframe their thoughts, SCI patients will begin to perceive their injury less of a threat and more as a challenge to be overcome. So this is one of the things that we'll do during psychotherapy with SCI patients in the hospital. All right. Other than that, since some of them they have pain issues like neuropathic pain, it also will be very helpful to discuss this with medical doctor to start on painkiller. And beside medication, we will also provide pain management technique with psychotherapy, which is a psychotherapy that will teach a patient on how like your pain is actually associated with emotion and also your thinking process. And it will be very helpful for patients to actually receive support from family members, peers, community, and also organization. Like one of my patients, he shared that he almost got into depression after the accident, but after he met his teammates from archery team, he started to gain back his power. You know, he gained back his motivation in life, saying that there's now something that I look forward to, and also people who can understand and support me, just like, you know, and accept me just the way I am. So yeah, so actually to receive support from others, external support is very helpful for the SCI patients. Besides that, patients will also benefit from a proper and clear self-management plan. All right, so self-management plan, it covers 4 areas: physical, mental, social, and also spiritual. Because SCI patients are also at risk to develop secondary medical condition. Therefore, it's very important to maintain good physical and mental health. All right, so last but not least, problem-solving skills may also help them to understand that there are ways to resolve their problems, hence will give them hope for future. So we will teach them problem solving skills. We will start to discuss with patient what are the problems that they have, identify the problem, and find out the ways to resolve the problems. And when they actually found out that there are ways to resolve the problems, there is hope for them. And based on past studies, it shows that many of the SCI patients, their coping skills is actually hope. So they hope for a better future. They hope that they can do new things. So this thing is actually one of the coping strategies used by SCI patients. All right. But because of the emotional reaction, right, emotional response elicited by the patients, we also need to be very vigilant of these symptoms. All right. So symptoms listed here in this slide is actually many of them actually symptoms of mental health issues like depression, anxiety, and also post-traumatic stress disorder. So whenever patients show this kind of symptoms, it is very important for us to refer them to psychiatrists or clinical psychologists for further intervention and for further intervention as a treatment. All right. So as a general rule, better health and length of time since injury are associated with decreased risk of psychopathology. So we have to act quickly, especially if patient is um, showing, if patient is actually having suicidal ideation or lack of desire to live. So this is like a red alarm for healthcare providers. When you found that your patient has this, then memang kita kena refer to psychiatrist and clinical psychologist for further intervention and treatment. Alright, so if patient feeling hopelessness, helplessness, and don't want to cooperate during, let's say for example, during rehabilitation process, during the therapy, so these are the things, these are the signs that call for next referral to clinical psychologist or psychiatrist. Alright, okay. All right. So, what will the psychiatrist do? Psychiatrists will normally evaluate a patient's need for psychotropic medication, which is depending on the range and severity of psychiatric symptoms and their classification. So, whenever patients are showing these symptoms, when you send them to psychiatrists will evaluate the symptoms, the severity. And psychiatrists also will decide whether patients will need medication or not. Let's say if the patient is depressed, psychiatrists will decide whether patients will need antidepressant or not, or whether or maybe some patients they will have like hallucination, delusion. So this will call for antipsychotic medication, but it all depends on the psychiatrist's assessment with the patient. Right, for us psychologists, what we will do is actually we'll provide individual or group psychotherapy as well as evaluations for patients who may have cognitive difficulties as a result of the accident. So remember that the three main causes of spinal cord injury is the first one was motor vehicle accident. So in motor vehicle accident, there are very high chances that patient will have brain injury. So if patient have brain injury, clinical psychologists will do a neuropsychological assessment to check on their cognitive functioning. And then from that, we will start to plan for their intervention plan. So because if they have cognitive impairment, then we'll need to change a bit lah our therapy, and also like macam OT, PT, you cannot like teach everything in one go. You need to chunk it into small procedures so that they can remember. So these are the importance of clinical psychologists for spinal cord injury patient. Right, for those who have cognitive difficulties. So in general, psychologists we will meet patient on regular basis to consult on behavioral or emotional problems that may emerge. And besides that, we also will help the healthcare providers with their emotional response with the patients, because some of the patients they may need like very tender care, and also very the nurse has to attend to them like almost every time, so it can cause burnout. to the nurses as well, or when they feel deeply with the patients, you know, so they will also cause emotional response to that. So we will also help the nurses with that condition as well. And we'll also provide caregivers with psychoeducation about caregiver burnout and also unnecessary dependency that patient may have towards a caregiver. All right, so basically that's how it is spinal cord injury patients, and also strategies to help them to rebound back from the low condition, you know, from the low mood, to actually bring them up to flourish their life, and so for them to be able to adjust healthily with their condition. And yeah, so I think that's all from me. All right, so yeah, so if you have question, I'll answer after this. I'll pass back to sister.
Sorry, I forgot to unmute. Okay, thank you, Cik Umi, for your information. Yeah, it's really, you know, this knowledge is very useful for us, especially from the clinical. You know, then we can, at least we can now understand how the patient feel and what should we assess, which ankle, and then, you know, that will help us in terms of caring for the patient. Yeah, so that is for the clinical aspect. Do remember, if you have any question, some of the nurses, if you have some question like, you know, the challenges of handling the patient or anything at all, please type in the chat. Okay, dekat bawah ada satu line ya. So salah satu ialah chat. So you can type your question dalam chat, and after that, at the end of the webinar, I will read the question out and then let our speaker to answer. Yeah. So that is the first part from clinical. So now we have a second part. Now the second part is very interesting because we have Madam Lau. Okay, Madam Lau, dia tajuk beliau ialah keep life going in this difficult and challenging time. Now she is going to more of sharing her experience to us. And also, you know, her experience, her success, her, you know, and also her life now. Okay, so now for Madam Lau, she is a SCI, okay, SCI patient herself. Briefly, her history here. In 1979, okay, she had a fall. Okay, she had a fall and she became a complete paraplegic T12 and L1. Okay, now ever since then she's on the wheelchair, of course. At the same time, she is also a cancer survivor of uterus in year 2005 and also a breast cancer in year 2019. Okay, so you can see, yeah, she have a very challenging life. Okay, but despite all this challenging life, she is very positive, I would say, yeah. Because she, you know, among all the, what do you call it, among all the involvement in NGO, okay, some of it, okay, I will just name a few. The current, she involved actually in a lot of NGO, but just I'm going to name a few current one, okay. She's the Vice President of Paralympic Council Malaysia, okay, from year 2016 to 2019. And she's also a treasurer of Malaysia Confederation of Disabled, 2018 to 2000, Vice President of Spinal Cord Injury Association, MASIA, until 2018 to 2000. And she is also a Secretariat Association of Para-Athletic Coach Malaysia, 2017 to 2019. So if you can see here, she actually very active in NGO to helping all the SCI. Okay, And if you remember what I mentioned just now, she is, in the athlete. So she is also, how to say, athlete herself, ex-athlete. She won many medals in international competition from year 1999 to year 2010. Okay. There are so many how to say medal that she won in this competition, so I'm not going to read out. But what I wanted to let you know is that she won 2 sport recognition, which is the best female athlete OKU category for year 1999 to year 2000, and also the best female athlete OKU category for year 2005 and 2006. Sarawak stage, because she's from Sarawak. Yeah. Okay. So without how to say talking, because she got a lot to talk. Okay. I mean, a lot of her what they call it, her achievement. Yeah. So I would like to invite now Madam Lau. Okay. To share with us her experience. Madam Lau. Madam Lau, you need to unmute your mic.
I'm mute already.
Okay, now can hear you.
Yeah, good afternoon to all. And thank you to B. Braun for inviting me to join in this webinar. I'm indeed appreciated and I feel grateful towards this. I met an accident, I have a fall in 1979 at my age of 19, whereby I got spinal cord injury, which at that point of time, nobody is aware of. I was not sent to hospital via ambulance or further medical care until my family members find out that I was in a very distorted stage. So they decided to use a speedboat then to send me to Cebu General Hospital. That's where they housed me for 2 months, 30 days without telling me my diagnosis. And I do not know what has happened to me, to myself. So later I was transferred to Kuching General Hospital. And then later in General Hospital, it is very important to me that I try to acknowledge what has happened to me. Why am I unable to get out from bed? Why am I unable to sit out? Why am I unable to stand or to walk? And most important thing, I do not know why I have lost control of my bladder and bowel system, which to many of us, or at my that tender age, it has never been an issue. So with that, I live in fear, in anxiety, and a lot of uncertainty. And then at the same time, while I was there, we were quite badly treated, especially the SCI patient. We were put in one cubicle at the end of the corner, whereby there is nobody came to visit us, or no nurse came and see us or what. And should in the event that we accidentally saw it ourselves, and the nurse will, actually only one particular nurse will always grin and ear at us and tell us, my little 5-year-old grandson can go and pull by himself. Why are you not able to do it? Actually, I myself at that point of time is seeking or is searching for that answer. Why I can't do it myself? I'm 19 years old already. Why I can't do it? So all this is a real lot of question marks to me, but nobody tell me what happened. I asked the nurse, I asked the doctor. There is no one will tell me what should I do. And then I continuously lying on bed. Eventually I developed severe pressure sore, later get chronic osteomyelitis with constant high fever. And because I don't want to soil myself, so I basically almost starve myself most of the time. And at that time, I'm less than 32 kilo when I am almost 5'6". So it is, I'm just, you know, I cannot imagine at that point of time, I'm just a skeleton. It is a life with no purpose, and I cannot see any future. And then at the same time, one of the nurses there at that point tell me that I am going to be a burden to my family. In order for my other siblings to have a better life, she encouraged me to attempt suicide. I attended suicide twice, but thank God for keeping me there, hang on, because there is always a purpose in life. Eventually, they transferred me to university hospital. Then I was in hospital university where I have I see more nurses, more caring nurses, and more understanding doctor. They come and explain to me, especially the medical students. They bring the book on spinal cord injured. They come and tell me what happened to me, why I can't pass urine or control my bladder and bowels. They are the one that show me the reason why, and because of my nerve injury, that is why I cannot do this on my own. But with certain assistive device like catheter, urine bag, you know, and then the bowel management, and then we can use time management, or there are some other things that can help us to do it ourselves. There I have a little more confidence about my future, because initially I was I live in fear and uncertainties and doubtful. What can I do? Shall I set a goal and to move on, or shall I just leave it as it is? So, and there is another very important aspect for the peer counseling. I met many spinal cord injured patients. They all dressed out, sitting on the wheelchair. They came and talked to me, and they got job, and they are such a sunshine to me, because in them I see my future. In them I can see at least there is a light along the tunnel, the end of the tunnel, where I can move on. So I was in UH for almost 2 years to treat my chronic osteomyelitis plus my pressure sore, and I was discharged later. And later, when I was discharged, I decided that I should stay in Kuala Lumpur rather than going back to Sarawak, because if I went back to Sarawak, I cannot even get down from my own house. What more to say to live an independent life? So I decided to look for a job in 1982, 83. But it is so difficult at that point of time. Nobody wanting to employ you because you are on the wheelchair. Some of them even tell you that, I'm sorry, we are not charitable organization. We cannot, we don't cater needs for you. So I have to search. If I want to stay in KL, I must get a job. So eventually I met one very good Samaritans, a very famous and well-known opposition leader then. He told me to start working in his office. That is where he provided me the foundation stage, the foundation stone, where I can move on with my life and continue staying in Kuala Lumpur. So I worked for about 7-8 years, then I move on. And then later I noticed that all this while I start setting goal at that point of time. What is my objective in life? What I want to achieve? My number one achieve is to have a roof over my head. Because at that point of time, I'm renting rooms. I was always being kicked out from the rooms. And when the kids got sick, it is always my problems because they think that I, as a spinal cord injured or on wheelchair, bring back omen to the family. When the kids having fever, it is also my fault. So to me, to have a roof over my head is the number one objective. So I started saving each month 50 ringgit, 100 ringgit, and for almost about 20 years. Then I started to buy a house of my own. That is why I have a more comfortable life. That I achieved one of my goals. Another objective in my life is in my teenage stage, before my accident, I was a school athlete for the district. But after disability, I dare not to think about what I can do. So at that time, I have quite a good job. I work as a secretary in Sangway College. So I am thinking whether I should venture into sport or not. Then I met Mr. HRN Story. He introduced me to weightlifting. So I joined weightlifting after my work every 3 times a week. And we train at Jalan Raja Muda Stadium there. So without fail, rain or shine, I'll be there. I train. And then within a year, they sent me for international competition. Through the international competition, only I noticed that it is so important for us to know the rules and regulation. What are the rules for the powerlifting or the weightlifting? What are the do and don'ts? So I read it out for myself, and I get it from the other country weightlifters. So I study, and then the first one I fail all my 3, so I get 0. So second round I compete again, and I got second position because I willing to learn, and at the same time I build up whatever muscle that is needed for that weightlifting in International Stoke Mandeville Games. So with that, I'm qualified for Sydney Paralympics. And Sydney Paralympics is also a turning point in my life because at that point of time, I work as a secretary, and after my qualification to Sydney Paralympic, I had to do full-time training, whereby it caused a lot of problem to my boss. So I was, at one point of time, I was almost calling it quick. But after I talked again, then they give me unpaid leave. So I continue training. And then I continue training in Sydney Paralympic. And unfortunately, I got 5th. I entered final and I got 5th. But to me, it's an achievement. And then further on, with that, I continue sports in 2002 in the World Championship. At that point of time, there is no Malaysian ever win a medal in the World Championship, powerlifting championship. And in 2002, I won the 3rd bronze medal for Malaysia. That is the first medal for Malaysia in the history of IPC World Powerlifting Championship. So after that, I have severe injury of my elbow. I cannot bang my elbow. I cannot straighten my elbow. So I have to, in a way, I have to give out. So even though I'm the top qualifier for 2004 Athens, but my injuries and my sickness doesn't allow me to further. I was admitted to PBUM for severe septicemia, and at the same time, I was diagnosed with uterus cancer. So after removal of all those uterus cancer and after treatment, I missed the Athens Paralympic. But then when I missed my Athens Paralympics, I decided to train further because for my love in sport. So I continued training and I moved on to javelin, shapat, and discus, the three athletics throw, whereby I continue in Manila SEA Games, Para Game. I get 3 goals and I set 3 new records. And then further on until then I have won numerous Asian or World Championship record. But then I still move on. My passion at one point of time is powerlifting. So I studied, and now I'm a qualified technical officer, technical delegates. It is a referee for powerlifting. And then when I move on to athletics, the training is very strenuous, and I retired after my Guangzhou 2010. We got a bronze, and then I retired since then. And then after retirement, I will have a lot of time for myself. So I start to participate in NGOs, because I remember during my hard time in my early disabilities, spinal cord SCI patient at that point of time, there are a lot of Samaritans that help me. They help me to how to say that, to encourage me, to lend a hand to me, to assist me financially, to buy a motorized motor for me so that I can travel to work. So, and when I am financially a little bit stronger, I want to repay them back. But they told me, pass it on. This is the motto now for me. I want to pass this on and pass on to whoever who needs my help. And during this COVID-19, initially I was caught off guard, because they say COVID-19 is #1 enemies to us, but I cannot feel it, I cannot see it, I cannot touch it, and I don't know where are them, because they are everywhere. So we follow strictly on the SOP to wear masks, to wash our hands frequently, and social distancing. So we seldom go to shopping complex, and the first MCO hit us and the surrounding spinal cord injured friends or OKU friends quite badly, because we are not prepared. Because when we know that it is going to have PKP, we wanted to go and buy provision, but we cannot go into shopping complex, or we cannot go to wet market, because the security guards refuse to let us in. And we were left without food. So the first PKP is a real experience for me. So I decided to share with my friends to see what we can do or what we can help our community especially in my vicinity in Kebun Baru area. So I get sponsored, and I look for people who are willing to cook, to bring the food to us, and I dispatch it to all my spinal cord friends. And one meal, we send about 80 to 90 packs to the family and friends of OKU, including the B40 or the nearby old uncles and auntie. So this is some of the things that we do during this PKP 2.0. And but very important things for us is to remember, we as a spinal cord injured, excuse me, 1 minute. We as a spinal cord injured, we really need to take care of ourselves. And during this PKP, if you are not well, you feel sick, go and seek treatment. But unfortunately, in the hospital, because most of the frontiers or doctor and nurses, they are so much concentrating in combating COVID-19, they forgot about taking the basic care for the spinal cord injured. Few of my friends, because of chest infection, that was admitted. Then they ended up, sorry. They ended up to have severe pressure sore. And then due to severe pressure sore, they have septicemia and they pass away. It is very important for us to keep ourselves healthy. I'm sorry, after talking too much, my throat very itchy. Excuse me for a while. Thank you for your patience. And nurses play a very important role in our SCI to the SCI patient. Why I say that is because my personal experience after my operation, after my plastic surgery, I was sore for 2 days. Wow, tough. Okay, I'm much better now. Yeah, after my plastic surgery, I was sore, and there is no nurses to help me to change my diapers because I cannot get up after my surgery. So it was left for almost 2 days. I am very scared, worried, because I'm worried that this may further injure myself, because the area of my plastic surgery is also at my bedside. So if I soil, it will contaminate my wound. So eventually, I told one of the student nurse, she is very helpful. because I'm not her patient, because the nurses was assigned to different cubicles, you know, you are taking care of cubicle 1, 2, or whatever bed, you know. So that nurse is not assigned to my cubicle. So when she, during her off duties, when she finished her duties, she came to me. She said, Kaka, I'm sorry just now, I cannot help you. Can I help you now? I'm so grateful, indeed grateful for her to change me and to clean me out, and I can continue to lie prone, because I was advised to lie prone at that point of time. I cannot sit up, and I have to lie prone for 6 weeks in order for the wound to completely heal, because I have severe pressure sore. So I was indeed grateful, and I also hope that the current or student nurse or nurses be a bit more compassionate to the SCI, because there are a lot of issues or things that seem very easy for you all is very difficult for us, especially for those who are cervical injury. They cannot even get out from bed on their own. And during the MCO #1, they were left in bed for days because everybody is scared to go out. No one is willing to come to help them. So they were stranded because a lot of us here are not staying with their families. We try to be independent. We stay with our family. We stay with our friends or our OKU friends. So sometimes personal assistance is needed, is essential for them, for us to live an independent life. Saying things like living independently is very easy for any one of you all, but it's not easy for us because of our SCI, and at the same time degenerative physical health, and then our hand, our shoulder cannot support us, especially now I'm 61, and I have noticed that, you know, in the morning I want to get up, I have to exercise a lot first because my hand, my shoulder are stiff, and then my finger, you know, unable to move, and all this take a long time. But bear in mind, I'm just a paraplegia. Getting out from bed is difficult. What about those tetraplegia? It is very hard, very difficult. Without assistance or personal assistance, it is how to say that, it is unable. They are not able to live active life. And then furthermore, during this PKP period, and many of my OKU friends, the EPC, allowance pekerja cacat, was suddenly potong, cut without any notice. And because some of them depend on EPC. Why I say that? Because during MCO, those are then are working part-time are not allowed to go to work. Those who are selling tissue or selling lottery tickets, they cannot go out to sell the tickets or the tissue paper because the store, the restaurant or the market is not open. So they lose the income. So they depend on the EPC to have to continue with the living. But then it is very, we are very vulnerable. And at the same time, it is very difficult. I don't understand why JKM can go and cut off the EPC at this time. So because of all this, I hope that whatever ministry that is taking care of us be more sensitive to our needs, and in times to come, to pay more attention on our vulnerable group. And life is tough, but tough is going. No matter what, set your goal and move on. And at the same time, with COVID-19, I encourage all my friends, go and vaccine yourself and register for it. And even though it may not give you a complete cure, we still have to follow SOP, and life must move on. That is all for me today. Thank you, everybody, for listening, and thank you to bear with me just now for my cough. Thank you.
Okay, thank you, Madam Lau.
Thank you.
Yeah, your story is so motivating. Your experience is really, but you are so strong and you are so motivated. So it's really very insightful to us, especially the caregiver, to understand, you know, your as an SCI patient, what are their needs, their physical and their emotion needs. You know, because you know, I think this is actually a lot of times as a nurse, or you know, or even sometimes family member, after some time, you know, a SCI patient is still a person. They also need you know, other than the basic need, they need from us. Yeah. Okay, so now we will go on to Q&A time. And let me check the chat. Yeah. Okay. Now there's one question coming from Hassana. Okay. She asked, I hope it's a she, huh? I think she's she. Okay. During pandemic, with all the challenges and the SOP, how we could get help for our patient, and where can we get how could we help is one, and where can we get the help for the continuity of care? Yeah, maybe Umi, you can give a little bit of suggestion.
All right. Okay. So for patient with SCI, normally they will have continuity of care with their respective hospital that they have been referred to, right? So can continue on that, as well as for physiotherapy or occupational therapy. You can, if the hospital has a rehabilitation punya department, then you can continue its the care over there. However, if they don't have any, you can find any private centers that offer physiotherapy and also occupational therapy. And for the psychological part, there are also centers that have clinical psychologists that is available for assessment and intervention.
Sorry, Umi, want to check with you. Is there any something like a hotline that they can call to, you know?
Hotline for, you mean psychological issue? Oh, psychological issue. So far we have Befrienders or Mercy Malaysia. They do have a hotline, but this is only for psychological issues, not a medical issues or any like you know, if you cannot walk and then you call people can come. There's no such thing. Yeah, they still don't have that.
Yes. Yeah. Because we also understand now hospital do not encourage you know,
patient to come.
Yes, exactly. Yeah, so they want to limit, you know, the number of visitors coming to the hospital. So sometimes we also know that, you know, especially family member, they have some challenges. You know, especially when they recognize, you know, some when their loved one is experiencing some kind of emotional disturb. So, you know, so where do they call for help? In Cheras Rehab, there is no hotline they can call in.
No, so far we don't have any.
Okay, right. I see. Okay. Now, actually, this is also one of the same question I wanted to ask also.
Yeah.
Because we find that especially this time is difficult to go around.
Mhm.
So family member need to have some sort of information. Where can they ask for help? Yeah, I think like Madam Lau mentioned, some of the OKU, they have their own internal, so-called internal support group. So the support group actually go around and helping their member. Yeah, I think the other alternative is by seeking the help of this so-called we call it what, home care services. Yeah, like Caregiver Malaysia, they are actually home care services. They provide nurses to go to the patient house. So if patient require nursing care, but difficult to reach to the hospital, then you can go for this kind of home care services. Of course, I am also a medical person, so I will only suggest a medical qualified, nursing agency. Yeah, not those, like maid agency, that kind of things. No, yeah. So a medical qualified services agency, and then they can, at least the nurse that, go to the house, they know what to look up. And then if the nurse think this patient need referral to either psychologist or psychiatrist, then they at least can do some suggestion to the family member.
Yeah, sister, do you don't mind I come in for a while? Everyone, I'm Gwen from Caregiver Asia. So like sister say, you can ask for home calls. Our nurses are all with APCs. So basically they all are well certified, and for the problems that were mentioned, right, like whether to go to hospitals and especially post-COVID and things like that, we do have professional medical escorts. And also for psychologists, we also have psychologists on our platforms. So later on, we will put down the numbers and also information for you guys, like easier if you have any patient ask you for that, we can help you with that. Yeah. So thank you. So if you have any question, you also can email us or call in. Yeah. So yeah, sister, you can take over.
Okay, thank you, Gwen, for the information. Okay, the other comments is, we want to thank Madam Lau for sharing your story. So inspiring and encouraging. You went through so much difficulties, and every time you come back stronger. So that kind of perseverance and also the strength to continue to fight on is amazing. Thank you, Madam Lau. And the other one is, okay, one more question is that, how do we know a SCI patient require just psychology consultation or psychiatric medication or combination of both?
Is it for me?
Yes, for you.
All right. So it depends on the assessment. So whenever patient comes into the clinic with symptoms of depression, we will do the assessment and we will determine the level of severity. So according to clinical practice guideline by Malaysia, by KKM, so for those who are in mild to moderate range of depression, it is suggested for them to go through a psychosocial and also psychotherapy intervention. All right, but for those who are in the moderate to severe level, then it will be a combination of psychotropic medication and psychotherapy. Yeah, so it depends on level of severity of depression that a person has.
Usually, what is the percentage like? Stand alone, the percentage of stand alone and percentage of a combination of both. What kind of through your experience, through what you see lah?
If we see a patient like at a very early stage, so we will be able to prevent it from, like, it's still in the mild stage, so psychotherapy is enough. However, if we see like patient later than like maybe more than 6 months, probably the symptoms have developed to severe range. So in this condition, then we need to refer, psychologists will also refer this patient to psychiatrist, because we cannot proceed with psychotherapy if the patient is severely depressed.
What do you think that in Malaysia context, SCI patient, they are open to psychologists and psychiatrists?
I think they're not very open to that, because it's kind of new for them. And also like awareness of seeing psychiatrists and psychologists among the public is still very low. So they still think that, say, you're crazy, that's why you see psychologists and psychiatrists. But actually in the hospital, like hospital rehabilitation ceras, what we'll do is actually whenever patient is admitted a ward, right, within 1 week, this patient will be seen by me. So we'll do an early psychosocial assessment, and trying to identify any emotional difficulties, behavior difficulties, family issues, occupational. So all this will be identified during during a session with me, psychosocial assessment. So we'll discuss with the patient as well as the caregivers, and also a team of mine that consists of specialists, occupational therapists, and also physiotherapists about this patient and what to do with them, like the treatment plan. So it comes like hand in hand, together we work together.
Okay. Okay, actually, from what we hear, Cheras Rehab can do a lot of things. And yes, and a lot of patients actually benefit from that. Yeah, so actually our medical healthcare is very good actually. yeah. Okay, right. Let's look at the next comments. Carl La Roville, okay, he said that he commented, I think it's a he, okay. He commented, Madam Lau reminds me just how vulnerable we are to life unexpected challenges we can face at any time. May I have the strength to face them as courageously as she has. Yes. Okay. Right. Okay, and then let's see. Yeah, Atifa also. Oh, Atifa asked either there's a link or not. Okay, never mind. Okay. The other one is to Madam Lau, how you build your positive mind during all the challenges and encourage yourself to fight it.
Yeah. How do I build? Because I'm grateful. After my 2-time suicide, I'm still alive. God gave me the life, and I to treasure what I have. And at the same time, previously I was crying almost every day, but day in, day out, tomorrow still the same. So I decided, at one point of time, I drink a lot. I mumbled myself. But then still day in, day out, still tomorrow, still I have to wake up. So instead, I told myself, I set a goal. Every morning you get out, you sing a song, then you cheer yourself up. Then tomorrow will be a beautiful day. And whatever problem or issue come by, you tell yourself, don't worry, I can do it. It is just a small issue. I will continue to do it. And there are a lot of my friends, especially medical friends, they always give me support. They say that, Lau, don't worry. If you need financially, they will help me. But thank God that I never asked from them, because to me, I have to be self-reliant. And life must go on despite of whatever disability or whatever situation you are in. Because as an athlete, this is the perseverance and the spirit that you must have in, so that you can, that is the winning point for you in life. It is very important. Okay.
Yes, thank you, Madam Lau. Thank you. I think one actually this also answered the next question because the next question is actually asking what are your biggest driver to move forward. Yeah, I think what you have shared just now, it tells us that that is your driver, because life needs to go on. Yeah. Okay.
I think not only that, the very important thing is for us that spinal cord injured, we have to know what is our disability. We cannot move our leg, we cannot walk, we cannot stand, that is it. But then how could we use other assistive device to carry on with our life? So we always think, never think of the disability will be there. It is how we go to motivate ourselves to get out every day to tell ourselves that tomorrow is a better day. We should move on. Thank you.
Okay. Okay. We have a question for Umi here. In a short summary, okay, what is your one advice, yeah, for the healthcare providers when dealing with patients with SCI?
Be empathy. Because like what Madam has shared before, it's a very tough situation. It's very hard situation for them. Considering that, you know, at the age of 19, you still cannot control your bladder and bowel, and still need help from others to move around, and you don't know what's going on in the future. Can I work? Can I study? You know, will people accept me as who I am? So all this causes so much insecurities and also anxiety in patients with SCI. So as a healthcare provider, I think it's very important to be empathy, to listen to them, and also to understand that what they are going through is very tough. And as a healthcare provider, what we can do is actually to support and guide them towards being independent and to function in the community.
Yeah, I totally agree with Cik Umi. Be sympathy, and I just like to share so-called one principle that I have when I was when I was very that time young lah. Okay, when I first joined nursing, the foundation or the principle that instilled to us, okay, us means that time still student nurses lah, is to be in the shoes of your patient. You put yourself in their situation, then you will understand, what they need. Because again, when we are talking, especially now, okay, those days we already talk lah, but now I think more and more, medical healthcare we stress on this is, every patient, they have they are not the same. We cannot treat all patients the same. We have to, how to say, that's why like Umi say, in every discipline, medical, why we do assessment, because we need to see what is the need of the person. Yeah, I think this is very, very important and very, very critical, because at the end, again, whenever I talk to my junior nurses, a lot of times I tell them, say, if you don't do assessment and you just do, at the end of the day, you may not achieve what your objective. So it's like wasting your time doing doing the things that is not necessary. So why do that? Instead of, assessing the patient, know what they need, and then, so-called plan their needs. I know it's very, very tough lah, very tough to do this, because in medical, in so-called medical, in hospital, our work, our life are also not easy. Yeah, but this is what we are. We are called to do that. Yeah. Okay. So this is what I would like to how to say, share. And I think Umi also share so-called mental health services in Malaysia. Yeah, so these are actually the link that you can go in and you can see, you know, if you have patient, or if you have, you know, people around you, you know, need some you know, counseling. Yeah, you can log in and you can look for these services in Malaysia. Okay, right? Is there any more question? Okay. I see if there is no more question. I need to say thank you both speaker and organizer for the talk, such as inspiring input. Yes, thank you. Hopefully, you know, with this talk, you how to say, you benefit from it, and yeah, I actually make you know, make this you know, these people and the life, you know, around us better. Yeah. Okay, right. If there is no, let me see. I think there's okay. Okay, right. This is link kehadiran. Okay. Untuk No Adila. Okay, you punya link kehadiran. Actually, yes. This is what I'm coming towards the end here. Now, for this, yeah, the what they call it, after this webinar, we will send out a feedback form, okay, through email to you. Okay, so you complete the, actually it's a feedback survey lah. So this feedback survey, after you complete, you submit, then what we will do is we will send an e-certificate to you through email again, okay. We will send an e-certificate to every one of you, all the people that are attending this webinar today. Of course, the e-certificate will only come after 24 hours lah. Yeah, not immediately, yeah, because we have to compile the, you know, your attendance and also your email. Yeah, okay. But what important is, after you submit the feedback survey, then we will send the e-certificate to you. Then you can use this link what do you call it, this e-certificate for CPD purpose. Yeah, okay, right. If there is, oh, okay, right. There's one question come. Okay. Oh, to Madam Lau, how to tackle those people with SCI but refuse any treatment?
How to accept SCI but to refuse treatment? I think a lot of the SCI previously, I also at one point of time I fall into depression. I also how to say that, I also refuse treatment because in my mind I just want to die so that I won't be my burden to my family, so that my other sibling can have a better life. But for me, it's peer counseling. The peer counseling will do a lot of help to the individuals. If anyone need counseling on SCI, if time permit, or if it is not too far, I don't mind going over to have a chit chat with them. Peer counseling is very important, so that use our personal experience to guide the person to stand up, because we are in the same shoe. We were, you know, we are in the same shoe. We got same problems, you know. They can see that is where my beginning, my acceptance of disability is also through peer counseling. Okay.
Yes, like what Madam Lau say is very true. Peer support is very important. Yeah, because whatever said and done, maybe me, maybe Cik Umi, we attend to the patient, you know, but SCI patient will think that how do you know? You never experience what I experience. You don't know what I go through, you know, because we are not a SCI patient. So that's why a peer support is very important, because they have gone through this. So especially when a new SCI, when they look at Madam Lau, she is today, okay? If she can achieve what she is today, why I cannot, Right?
Yeah.
These are the kind of motivation that we can give to a new SCI. Actually, there are a few support groups in Malaysia. Madam Lau is the vice president of MASIA.
Yeah.
MASIA, MASIA. Yeah, there are other support group available also in our community. Yeah, so in fact, some of the support group, they even work with the hospital, the rehab unit, so that at one time when the rehab unit, they have patient and they, especially because you also understand rehab is not like for life. You cannot be going to the rehab for life. So at one time you need to be discharged from the rehab. So what if the patient do have some, problems, or, problems that they face after the discharge? Where do they get support? So this is where the support group can come in. They can advise the patient not from the emotion, not just emotional, but even like, how to apply kebajikan lah, where to go and buy a wheelchair lah, things like that. Yeah. So this support group can help. Yes. Yeah. Okay. Right. So let's see now. Okay. If there is no question, I think we are just on time now. It's 4:28. We are just on time to end our session. Okay. And again, thank you very much for especially our both speaker, Cik Umi and also Madam Lau, and of course to all our audience, our participants. Thank you very much for attending, and hope this webinar brings some knowledge and also insight, to you. And it helps you in your daily work, especially if you are the healthcare professional. Yeah. Okay. Right. So thank you again, and hope you enjoy, and have a nice weekend. Yeah. So yes, we can end now. Thank you very much.
Thank you.
I think Cik Umi and Madam Lau can. Do we want to take a photo? Organizer, do we want to take a photo?
Yeah. If anyone, you guys don't camera shy, can turn on the camera, then we'll take a photo together and we can dismiss after that.
Yeah. So kalau you malu nak tunjuk muka, then you can turn off your camera. Kalau you masuk dalam gambar, yes. Yes.
Thank you. Okay, are we ready? Wait. Okay, 1, 2, smile, 3. Nice. Okay. Oh, ada piece lagi. Okay. All right. Thank you, everyone, for joining. All right. I think we are good. Thank you.